Hello, everyone, and welcome to the HealthyXSundays podcast, where we bring you the most critical and actionable content in the nutrition and fitness space. Dave from Mind Muscle Pro and I, Kunal Jain, also known as Veg Diet Coach, are your hosts. We are really excited to introduce our guest, someone whose work is incredibly relevant, especially for us in India, where many of us follow a vegetarian diet. Please welcome Tracey Witty, the founder of B12info.com, a trusted global resource on vitamin B12 deficiency. Tracey's journey started in 2012 when she was diagnosed with a hereditary condition that prevents her body from absorbing B12 from food. Since then, she's been on lifelong B12 injections and, more importantly, on a mission to spread awareness about this silent but serious issue. Her work is eye opening, especially in highlighting how symptoms like fatigue, low mood, memory issues, or nerve pain can often be due to something as simple yet overlooked as B12 deficiency. But what makes her voice so important for us in India is that B12 is mostly found in animal based foods. So vegetarians and even vegans are at a higher risk. And many of us don't even realize it until things get worse. Tracy has helped thousands of people worldwide through her website, resources, and advocacy. And today she's here to share her insights with us. So without further delay, let's hear from her directly. Welcome, Tracy.
Oh, thank you, Kunal. Lovely to be here. So yes, I did start my journey when I was diagnosed in 2012, but prior to that, it was a loved one who was sectioned, so held in a mental health facility due to her B12 deficiency that really started me to think, goodness, nobody seems to know about this in the health profession. The psychiatrist involved in her care suggested she just eat some broccoli, and that just astounded me, that the level of kind of ignorance about where B12 comes from.
Right. So, can you talk about what challenges did you face in getting a proper diagnosis and how did you overcome them?
Well, for the loved one I spoke about, because she had a mental health diagnosis, unfortunately, what seems to happen is that that person and that mental health diagnosis kind of sidelines any further investigation into physical health. So I really had to fight to even get her tested for both a thyroid condition and vitamin B12 deficiency, which, as you know, have many overlapping symptoms. It was a real struggle, and in fact, I went through two doctors before I found one who would test for both the thyroid and the deficiency. And then to try and get it treated as per what we have in the UK, NICE guidance, was another trial. What generally happens in the UK, if they do find a deficiency, sometimes people are sent away being told they can just take tablets, which is fine if you can absorb through food and you can absorb from tablets. But if you can't, it just delays any kind of improvement. So to try and access B12 injections, there was a loading dose started, but the loading dose just really consists of 6 injections over 2 weeks generally. But what should happen is that frequency continues until the symptoms stop improving. So it did actually take 7 months for the doctor to finally, even though I'd sent rafts of information, for him to understand that there would be no harm done if he treated his patient with every other day injections. And then the improvement was profound. But it was a real fight. And I think it was at that point, prior to that, really, panic set in about the fact that it shouldn't be like this. This is really simple. B12 is really cheap. And there are millions and millions of people suffering from just being, having a mental health diagnosis and actually being ignored. And then others who are misdiagnosed because our doctors and healthcare professionals, all in any discipline, have been done a huge disservice by not being taught fully about nutrition and in particular, in my sense, of B12 deficiency.
Right, Tracy. So I believe this was your motivation. Can you share more light on what was the motivation behind creating b12info.com, and what are your goals, and what's your aim? What do you want to achieve from the website?
Well, really, what I found I was doing was I was shouting in an empty room in a way. I was sending disparate links to doctors. I was trying to raise awareness just as a person. And it was a friend who said to me, Laura, who said, why don't you just do a website? And I thought, oh, yeah, that'll make sense. Then I can put everything there that we need, and I can act as a hub, and I can send people to the right information for this. And so doing that, just changed everything really. It gave both patients and clinicians somewhere to come to and have a look and really, research and understand what patients were going through. What I really, in the UK, we cannot buy vitamin B12 ampules over the counter. Our MHRA decides that, it has to be diagnosed and it has to be treated by a doctor. And unfortunately, because of the lack of training, then it means that many, many people are undertreated. So, as I said, the loading dose was 6 injections over 2 weeks, but then what often happens is that that patient then is sent away for 3 months and they can't have another injection. They can only have injections 4 times a year, which keeps people poorly, very mentally ill, sometimes bedbound, and unable to participate in life. So I tried back in, I think it was 2014, I started a campaign with the government to try and make B12 injections available over the counter so that we could go to a chemist and buy B12 ampules like many other countries allow their people to do. And unfortunately, we've had a Westminster Hall debate. We got to a private members bill with 10 years of campaigning, and then unfortunately the government changed. So all that work is lost, and you have to try and find the strength to start again. But it's really simple. It's just, it shouldn't be that B12 is kept from us as it is. It's very safe. You can't really overdose on this. And many people, children are sent away with injectable insulin, and lots of people are sent away with heparin to inject. And they've both been used as murder weapons, whereas B12, this would be impossible.
Right. And I believe you're also pursuing a PhD. So,
Well, I
yeah,
started a PhD back in 2020. I've suspended that at the moment. My lovely supervisor retired to Italy, but that is on the back burner and sits there.
right. Dave?
So, you mentioned a couple of times the lack of knowledge among health professionals. So, why do you think this is the case? And I mean, it's supposed to be common knowledge, right, about B12 being such a vital um, vitamin. So, why is there a knowledge gap among professionals, at least?
I think honestly that a lot of medical training really focuses on pharmacology, on what medicines to give. And I think it just seems madness to me and to most people who are B12 deficient, who know about B12 deficiency, that the fundamental um, groundwork for any kind of health is missing. If you were an architect going to study architecture and they said, oh, we're not going to cover foundations, we're doing nothing on foundations, everyone would think that was madness. And yet, nutrition has such a tiny part to play, it seems, in most medical training. It's it's just astounding. And I think that naturally our doctors who have spent 7, 8 years at university, they must feel, well, hang on, if I needed to know this, I would have been taught about it. So there's real resistance sometimes when patients go into the doctors and they're often finding their own deficiency and trying to access treatment. Their previously perhaps good relationship with their doctor then changes, and it must be really hard for our doctors and our nurses to be asked about something that they sometimes know very little about, or what they've been taught is that people can have too much, that people only need 4 injections a year. So the information they have got needs to be reviewed and needs to be updated.
Right. So, what there for somebody who's not aware about B12 deficiency, like what are the symptoms? What are some of the symptoms a normal person should be looking at?
Oh, there are so many symptoms because B12 deficiency affects all body systems. So from head to toe, you might have prematurely graying hair, you may have blurred vision, tinnitus, you may have a swollen tongue, you may have gastric problems, bowel and bladder problems, you may have an ataxic gait, numbness and tingling in the extremities. It can cause so many problems, but I think one of the best way to sort of describe the signs and symptoms is perhaps to talk to you about what B12 deficiency can be misdiagnosed as. And that are things such as bipolar, postnatal depression, Alzheimer's, dementia, multiple sclerosis, Parkinson's, ME, fibromyalgia, chronic fatigue syndrome. And so that gives a better idea sometimes of the kinds of signs and symptoms. And the list on the website, although it's huge, sometimes, I mean, they're the most commonly reported, but there are things outside of that people suffer from. And then once they're on B12 treatment, are amazed that another symptom has reversed.
Right. So when it comes to diagnosis, I believe there are two kinds of testing, mainly like the normal B12 testing and the active form. So which one should a person prefer? I believe the active form testing is a little more costlier as well. So is it worth?
Well, from my perspective, Dave, to be honest, the serum B12 test is what we have, what we use on the NHS and what most labs use. And using that test, there are 6 or 7 documents I have on the site which show the GP that there are limitations to that test. There are also limitations to the active B12 test. And unfortunately, that doesn't catch all people who are B12 deficient. But the problem with that one is that the result for that might seem finite and you are or you're not. At least with a B12 serum test, we know that it has its limitations, and we can see that the reference ranges are all over the place, depending on what part of the country you live in, which lab, what assay kit they're using. And there are alerts to state, if the patient is symptomatic, do not ignore a within range result. And that's what helps the doctor to really understand that, that we can't judge people on a piece of paper and numbers on that.
Right. So you would suggest going for the normal serum test?
I think so, because it's much more accessible, and we have the fallback of the documents that can help the doctor to understand that this may not be the full picture. If your patient is symptomatic, and this unfortunately is what happens, is that doctors will see that paper and ignore the fact that the patient sitting in front of them has a raft of symptoms of B12 deficiency, which
Right.
they may actually not be aware of. Certainly, mental health side of things, certainly the doctors in the beginning that I spoke to were totally unaware that B12 deficiency could affect your mental health. They were really looking for elderly ladies over 60 who have neuropathy, and ataxic gait, and more of that kind of thing.
Right. So if I were to understand correctly, what you're suggesting is functional deficiency, where the numbers might be okay, but if the person has all the symptoms, you assume it's a proper deficiency.
Well, I think not necessarily function. I mean, there is functional B12 deficiency, of course, and that can look much higher. But I think the problem with the test is that, say, for example, where I live, the low reference range for serum B12 is 220. So I was diagnosed at 216. And before I was diagnosed, I'd already done a lot of research, so it was easy for me to become, to get a diagnosis. But in areas, I think it's East Lancashire, their low reference range is 110. In Cardiff, In Wales, it is 130. North Wales, it's 150. So the point being that, in my area, thousands more people, if they weren't in Wales, would get diagnosed against in their own countries, they're being missed. They are literally being missed because that result can be batch filed as normal. And so no further investigations on B12. And it
Right.
really just does send people down a different route to try and find out what is the root cause of their problem.
Right. At least in India, I believe most labs have around 220 as the bottom limit. And we often see folks around the 200, 250 mark, and they consider themselves as not deficient.
Yeah. Yeah. And I think the thing is that we're all so different. If you are heavily symptomatic and your level is at 300, then, you've ruled everything else out, then try B12 injections.
Right. Kunal?
Right, Tracy. So, which forms of B12 supplementation are the best? Which ones do you think should be recommended?
As in the different forms of B12
Right.
or different administration.
Both. Can you cover both areas, please?
Yeah. So most of the people who I see who come to me are not able to absorb B12 from food. If it's a dietary lack and you're avoiding animal foods and you've no problems with absorbing B12, then oral tablets should be fine, absolutely fine. If you are on B12 injections, what we use in the UK on the NHS is hydroxycobalamin, and that form suits most people. There are, however, some people who do much better on methylcobalamin, which is injectable as well, and some people even take that step further back to cyanocobalamin, which was a form used in the UK up until around the 70s, I think. So America and Canada use cyanocobalamin. It keeps millions of people alive. And I think it's key to really think about the fact that we're all so different. We all might do better on one preparation or another, but most people, generally speaking, do really well on hydroxycobalamin.
Right. And Tracy, like once someone goes on supplementation, what should be the frequency of testing after that?
Once you're on B12 injections, there's no point testing the B12 levels. It's a waste of money. It's a waste of time because that will always show as high. So what can happen is that people, some doctors in the UK will give a loading dose of 2 weeks and then they'll test the patient's B12. And then they'll say, oh, right, you've got enough now for 2 years or one of these random figures, and they'll stop treatment. And the problem with that is that B12 will stay, there will be a picture of it in the blood for months after, even though you're feeling dreadful. Because the system hasn't had enough B12. It's a water-soluble vitamin. It needs replacing constantly. So to test for B12 once on treatment, unless there's a real problem with if somebody's not responding to B12 treatment, I think the rule is to test the reticulocyte count, but not there's no real need to test the serum B12 repeatedly.
Right. And once those injections are given, how long do you think they're effective? You mentioned like a couple of years, as the doctors say.
Well, no. So I have been on weekly B12 injections since 2012. Well, the first I had my loading dose, I was amazed at what I was able to improve on. I was just astounded. But then the doctor wanted to put me on to, a monthly B12 injection. She knew I had a clotting disorder, so she didn't try and push me to the 3 monthly, but a month wasn't cutting the mustard for me either. So she said she would write to a gastroenterologist who I'd never met, who then wrote to her stating that she should give me antidepressants and suggest I went for psychotherapy. So she asked me how I felt about his response, and I said, well, I could go and see a psychotherapist, but then I'd have to be saying to them when they asked me why I was there, well, my doctor won't give me the B12 injections I need. So I had to ask her, why did she think her memory was more important to her than mine was to me? So she did write out my prescription, and I've remained on a weekly B12 injection since that time. So some people are, I mean, that's my optimal. That's what it keeps me well. I don't go beyond that because then symptoms come back. So for me, weekly is great. For other people, they can go 2 weeks, a month, and longer. But really and truly, we need B12 regularly as individuals for our own particular lifestyles, for our own what it is that we need, not what is written on a paper, and one size doesn't fit all.
Absolutely. That makes sense. So I believe you don't do any kind of testing. You just do the weekly injections, and testing is really not required.
Not once there's a diagnosis there. So homocysteine testing prior to diagnosis, homocysteine test is a really good one to use. And we don't really use the active B12 test in many areas in the UK on the NHS, and MMA testing is not common, but homocysteine test, which, as you may know, that's an amino acid which can rise to toxic levels with low B12, low folate, and low B6. So it's a really good indicator. However, I think the optimal level for that test is around 6 or 7 rather than the 15, which is the low reference range.
Since you brought up homocysteine, so methylation defects and all these contribute to B12 deficiencies?
Yes. And I think it said, I might be right in saying that around 30 to 40% of the population have these defects. It's the reason that I'm B12 deficient. It's the reason the rest of my family are. And they are very common. And of course, that ties in for me in any way, a problem with folate too, which is, as Sally Patchlock puts it, the big sister to B12.
Right. And the particular condition which you face, that not getting enough B12 from food absorption, is that a very common condition? Or
Well, I think it probably affects around 30 to 40% of the population. It is said to be that pernicious anemia in the UK is the most common cause of B12 deficiency, but that is a lack of intrinsic factor in the stomach, and that's a big reason why some of the people in the UK are deficient.
Right. So one of the challenges which people, vegetarians and vegans have is there's practically no sources of B12. So what's your advice for vegetarians? You just get on the supplement, or is there another way, like
Well,
dairy or something?
did you say a berry?
Dairy
Oh,
products.
dairy, yeah. So if animal products are where our B12 comes from, and I appreciate if people are averse to eating dairy, then a supplement really is the way forward. There are sublingual supplements that you can put under the tongue in the methyl form. But yet supplementing with B12 is key. And I think the problem is that although I've said that if it's dietary lack, one of the big problems that can be missed is that if you are, say, diabetic and you're on a drug called metformin, that stops absorption of B12 from food. So even if you are eating dairy, you're not, you have a problem with absorption. So that must mean then that injections are the way forward for that particular patient. There's so many drugs that stop absorption of B12. And I think we have to remember that if you're a vegan or a vegetarian, there may also be a coexisting condition that stops absorption of B12.
Right. So one of the questions which we often get is that, so what about vegetarians in the previous generation? They never supplemented and they seem to do fine. So this is the question.
I think I really think that has to be with where we're born, where we're from, and there it is amazing that certain cultures can really survive without much animal product at all. And I think that's all to do with our ancient sort of makeup, really, because it is, I think in the UK, if you are, if you're used to eating meat or from what your normal foods and you don't, then that can become a real difficulty for somebody. And then, there has to be supplementation. And I know there are a lot of vegans and vegetarians out there who would disagree with what I say, but the problem is, I see firsthand thousands of people who are really struggling without access to B12.
Right. So one of the theories out there we have heard is that uh, more sanitation and more hygiene has really impacted, which was missing in the past, and that uh, through food and water contamination, you can get some B12. That's how people in the past survived.
Well, I think that, I mean, certainly they say, if you don't wash your carrots as much, you'll get something from the soil. But I don't know how real that is or how possible that is, and maybe so. But there are areas of land that don't have any cobalt in it. So if there's no cobalt there in the land, I know that farmers have to supplement their animals with cobalt. So I think it's a tricky thing, but I mean, clearly some people and some cultures do survive really well without B12
Right.
or without
So,
supplementing B12.
so you mentioned about folate being the big sister, right? So what other B deficiencies do you see, like B1 and stuff? Is that a concern?
It's certainly B1 deficiency. Well, all the B vitamins work together, as you know, and if you have a pre-existing B2 deficiency, as alongside B12 deficiency, that really needs to be treated first. Sometimes people reach me and they have been having B12 for months and they don't feel any better. And oftentimes it's because they're not taking any folate at all, and their folate isn't a good standard. We need that folate as the big sister to try and help metabolize the B12.
Right. So there's something called as folate masking, right? So could you just explain on this? Like, I think if you have overdose of folate supplement, you get in, it can mask some of the B12 deficiency symptoms, if I'm not wrong.
Well, I think it's so when you take a full blood count and if you've got a high MCV, mean corpuscular volume, and an MCH, mean central hemoglobin, if they're high, then and you take in and you've got large red blood cells, if you then supplement with folate, that can reduce the size of those blood cells. So that's, I think, where the masking comes from. So on a blood form, you'll think that everything looks fine. And I think in the past, then doctors were giving folate to treat B12 deficiency. But then, that's just it's a completely different vitamin. So it's not treating that, but on the blood, it'll look okay.
Right. And I believe one of the common reasons, besides the fact that we don't have much B12 rich food, is a gut issue, right? We see all sorts of gut issues, and they, without a doubt, mostly have a B12 deficiency as well. And in such cases, I believe a supplementation would be of not much better either, because the gut has to absorb them.
That's
So,
right, and I think that's why sublingual tablets certainly work for some people. It's missing out the gut; it's just going through your mucosa. But B12 injections, if you can access them, and I appreciate, that's really tricky in certain countries. But I think in India you can buy those over the counter, can you?
we
B12.
can buy the oral supplements. The injection, you have to go to a doctor.
Right, okay. So if really, if you've got a problem with malabsorption and the sublinguals don't work for you, then injections really are the best, the most efficient, the most effective way of
Right.
treating B12 deficiency.
And I have to tell you that homocysteine as a test, it's practically unheard of.
Yeah, yeah. I know it's tricky to get hold of here too. Really, it's a bit better these days, but yes, it's oftentimes. I mean, I remember back in 2012, I don't even know what that word is from a doctor. So,
Right. So before we move on, my final question is, uh, what values, like at least in like places like India where we have the option of just getting a B12 over the top. or there's an option of going to the doctor. So at what value, say less than 200, should I go to a doctor, or is there a particular number you would say, yeah, this below this, better get an injection?
Well, I think if you are symptomatic and you are any number, so Sally Patchlock would say, I think below 450, then that's that's an indication of a B12 deficiency. But if somebody is 450 and they have no symptoms whatsoever, then what's the point? We're all so different. But if the symptoms and the levels are low and everything else has been ruled out, and that's often what happens, the doctors will go to great lengths to rule everything else out. And then if B12 is the only thing that's left, then yes, get treated.
Yeah, doctors would prefer to go by the numbers than the symptoms, unfortunately.
I know, and that's the biggest problem for all of us, isn't it?
So, Tracy, is there a risk involved in B6 supplementation? Uh, does it cause any kind of damage if you overdo it?
Yes, well, B6 and B9 are neurotoxins, so you can overdo both of those. And I think that making sure that you are not taking high doses daily of those is really key. Um, Having said that, B6 can be given in really high doses for urinary tract infections with no ill effect, but it just depends on the length of time you're taking it for. In all cases, really, people, and certainly the people that I work with, they'll often become acutely aware of what is happening when they take which supplement. I mean, for me, I have taken B6 in around 40 milligrams 3 times a week over 12 years. It's not been a problem. But I think if you're taking massive doses of anything, then, that can cause an imbalance.
Right, Tracy. And any of these conditions which are associated with B12 deficiency, are they reversible completely?
Yes, and I think what is miraculous for people is that once B12 treatment has started, people who have had diagnosis of fibromyalgia, all sorts of different things, are absolutely amazed that they can come back to full life. I think that the really sad thing is that if B12 deficiency is in a child, then you cannot reverse out of all of the symptoms because the nervous system is still developing, and if that child isn't treated quickly and efficiently, then they can be left with lasting damage. But I was amazed. My mother, who was a nurse, she really didn't want to think she'd had a B12 deficiency, and yet I could see all the signs and symptoms in her. But she was saying, no, my bloods are good, my B12 level's 323. And at 74, she finally got onto B12, and she said, I've never felt this well. So for her, she'd long-standing anxiety, all sorts of different problems with her breathing, and she was absolutely amazed that at 74 she could reverse out of so many of those really debilitating symptoms. So as an adult, if we're getting the right treatment, the right level of treatment, and the right frequency, then we can be amazed at what we recover from.
You've been on like a long-term dosage of B12, like weekly injections. Can you dispel any myths regarding long-term usage of B12?
Well, I know that so lots of doctors will say, oh, it's dangerous to overdose, but it's been known to be safe for over 60 years now. I have, like my mum, I had never felt more well. I used to play netball, but my recovery was always much longer than anybody else's. As soon as I went on to B12, I was like, oh my days, I have no problem climbing up this mountain. There is nothing but good that I can say about weekly B12 injections for the past 13 years. And, it really should. But the point is that if we could absorb from animal food, if we could absorb B12 from food, then people really wouldn't be saying to us, you're having too much, you're having too much, It's because it comes in an injection. It's because it has to be injected. There's this sort of scariness around B12.
Right. And you have a community, Tracy. So can you share any stories, like success stories from your community with B12?
Oh, there are so many. I've recently been in touch with a family who the lady had been on B12 who her B12 had been stopped, so she was on 3 monthly and was really deteriorating, and she's now back on B12 regularly, and their mum is coming back to them. I have on the films page on my website, at the top film there was a Rotterdam conference, and in that there are 3 films of people, Claire, Leah, and oh gosh, Karen. And Karen was a mental health nurse. She was sectioned. She was absolutely distraught by what was happening to her. Being in mental health, working in elderly care, she also worked in brain research in New Zealand, and nobody could see her. She was really going downhill. She thought she got dementia, and her recovery was just incredible. Leah, who was an 8-year-old girl, was missing school, just couldn't participate, had no energy. Once she was on B12 regularly, just flowering, incredible. And then her mum, Claire, who was having fits, was really, really poorly, not able to even look after a child at one point. Once she was on B12 injection, just back to living a full life, able to look after a child again. There are so many amazing stories of people's miraculous sounding recovery because they've got that nutrient that was missing.
Right. So, could you just, for the sake of our audience, explain about the importance of B12 in pregnancy nutrition? Because that's something that's a major factor in the development of the fetus.
Yeah. So I myself had multiple early miscarriages. And so even I had around 2 rounds of IVF, but what I realized was that once I learned about B12, there was no way that was going to work because I hadn't got levels of B12 or folate with these methylation issues. So for the development of the fetus, for the mum, we need adequate levels of B12. And there's only, I think it's something like 2.4 in a prenatal pregnancy supplement for mums. But if you're not able to absorb that 2.4, because you've got malabsorption problems, then the mum is getting no B12 and the baby's getting no B12 either. So you can end up with a mum with serious postnatal depression, and then if the baby is breastfed, then there's serious failure to thrive in that poor baby. So it's really critical that we check the levels of mums who are pregnant and throughout that. And I know that again, there are things I think in the B12 ampules that will say check for use in pregnancy, but the point is that mum has no way of accessing B12 if they're B12 deficient and not able to absorb, because so it's absolutely essential that mum gets B12 supplementation that suits her, that means that the baby is also going to thrive.
Right. So if somebody is planning their pregnancy at least a few months before, should you be sorting this out?
Well, yes, and I think again, really and truly, if you have no signs and symptoms, if you've got no problem, you're fit and healthy, and you're supplementing with B12, then certainly be looking at that. But if there's a family history of B12 deficiency, then it's really something to be checking out for yourself and making sure that you are able to absorb from food if you can. If you are a vegan or a vegetarian and not supplementing, then added supplementation is really going to help. And if there are signs and symptoms, then, to go and make sure that you're having B12 injections for a healthy pregnancy and a healthy baby.
So what are your thoughts on fortification of B12? Like, at least for B9, there's a bit of a concern about fortified B9. So what
Yeah.
are your thoughts on fortification in general?
In general, for me, because I can't tolerate folic acid, I can see the benefits of it. For neural tube defects, I can see why it's a plan. But having said that, you can have too much, and you can have too much of the wrong kind. For me, folic acid doesn't suit me at all. I choose to eat a gluten-free diet, so I'm probably not accessing a lot of the fortified foods, and certainly in the UK, we're not doing it as much as in other countries. And if folic acid doesn't suit you or you're not able to convert that, then I think the fortification can be a problem. And I realize I'm complicating things by saying that, because the active forms of folate are can be much better for a group of society.
Right. So there's no fortification which involves methylfolate. Am I right?
I don't think so.
Right.
Yeah, it's folic acid.
So my last question is, how often should somebody asymptomatic test their homocysteine and B12?
If somebody's symptomatic,
Asymptomatic.
oh, I'm sorry, so I don't
No,
understand.
no symptoms, no symptoms.
Oh, sorry, if they're asymptomatic. Well, if they are asymptomatic, no need to test.
Right.
Yeah. I think
No,
often people are, people probably go for tests that they don't really need to. If you have no symptoms, you're fit and well, no need to test for anything.
right. And between homocysteine and MMA, which one is the better one?
Well, I have more experience of the homocysteine one. MMA is a good marker if you're high, but I think homocysteine, because it clearly shows that you've got a problem with folate, B6 and B12, then it's a really good test. The problem is the sample needs to be spun quickly and or kept on ice. So it's a tricky test. Even you can go to a hospital here and have it, and then that you'll return a result with sample spoiled. But if it's done properly, it's a really good marker.
Right.
Right, Tracy. So, what's one thing you wish every general practitioner or primary care giver would know about B12 deficiency?
What I'd love for them to know is that each person is individual, that it's highly prevalent in poor mental health, and that each patient is an individual. So the one patient who needs every other day injections is not unusual. That person who needs a weekly injection is not unusual, and that actually individual treatment in B12 should be considered, as it is in lots of other conditions. We need to understand that people are individuals, and that if they say they need more B12, they really do need more B12. They're not, nobody wants more injections than they need. They just want to feel well.
And your message to people who are deficient in B12, how can they better self-advocate for themselves in clinical settings?
I think the biggest problem we have in UK culture anyway, and probably less so in the US, but is really feeling that they can talk to their doctor. They need to be able to stand up for themselves with their doctor, and not just go away with a tail between their legs if they're told they can't have more B12. I think I try and encourage, when I work with people, to have confidence in their own voice and speak up and stand their ground, really, with their doctors, and even suggesting, what would you do if I were your sister, your mother, so that it kind of tries to find a way of accessing the treatment they need without going away feeling like a hypochondriac or that they're wasting people's times. And I think so many people in the UK don't want to upset their doctors. They don't want to challenge them. But actually, I think that it's becoming clear we really do need to do that. And I certainly, right at the beginning, had to do that. I had to stand up for myself, and I had to fight for others. And I'm more than willing to do that, because I think it's essential these days.
Absolutely. And I think we spoke about metformin and affecting B12 absorption. Does the same happen with antacids and PPIs?
Yes, there are lots of drugs that cause malabsorption of B12. And And I think the problem is that so many people are put onto acid suppressants, even small children put onto acid suppressants, and then but our doctors don't necessarily understand that that causes B12 deficiency. And as I said, they're often not looking for B12 deficiency in children, but the regression of a child and who's been put on acid suppressants at a young age is, it's essential that B12 is looked for and understood. I think a lot of people who take drugs don't necessarily read the side effects, don't necessarily read the important stuff in there. And maybe a lot of our drugs don't have warnings that say this could seriously stop you from absorbing B12. So that would really benefit people. I mean, when I meet people and they say, "What do you do?" and I mention B12, loads of people still have no idea what B12 is. They have no idea. Unless they had a grandma who was on B12 injections or they know somebody else with it. It's an anomaly, there's so little understanding. We weren't taught about it at school. So it's just that there is a massive need to raise awareness of B12 deficiency.
And and probably the last question from my side, Tracy, is does drinking black coffee or coffee impact B12 absorption? Any idea on that?
I don't know really. Are you talking from if you eat animal products and then having black coffee or?
Probably, yes. After a meal, yeah.
Well, I think that having any coffee or tea, if we're trying to get the best from our food, we kind of need to abstain from that for at least a good 20 minutes.
Right.
And that's what I tend to do if I'm taking any supplements. Just try not to drink anything with tannin in or caffeine in for a good while before or after. But as far as B12 injections or anything, you'll be fine.
Great. So I think we've come to the end of the podcast. Do you want to give any message to our viewers?
Um, Well, I suppose really what I'd love to say is that, B12 deficiency is common. It's really commonly misdiagnosed. If you have family members with it, then look out for it in yourself. If you have anybody that you know who's been diagnosed with a mental health condition and hasn't been tested for B12 deficiency, let them know about it. If you know somebody who's struggling to conceive, and it can be men and women, it can cause infertility in, then let them know about the site and really just try and spread and raise awareness. There are some posters on the site if people want to share them. I think one of the biggest things is that it is considered, certainly in the UK, to be a condition for older women, and they don't realise that, tiny babies and children all the way up, men too, can also suffer severely from B12 deficiency. So just really just familiarising yourself with the causes and the signs and symptoms and just keeping it in the back of your mind.
Right.
Thanks, Tracy. I think we had a wonderful discussion on B12 deficiency, and thanks for answering all the questions wonderfully. And your website, it's amazing. It can be translated in different languages, so it definitely caters to the worldwide audience. And with that, I think we would like to thank you again for coming on our show and answering all the questions. So we wish you
Oh,
all the best.
thank you. It's been my pleasure. Thank you for having me.
All right, take care.
Take care. Nice to meet you.